We hear the phrase heart disease all the time, right? But have you ever actually stopped to wonder what is physically happening inside your body when it strikes? It's literally a fascinating mechanical process. Okay, let's dive into this. Welcome to This Explainer. Today, we're going on a pretty incredible journey through the human cardiovascular system, exploring cardiovascular disease from its absolute root causes, all the way to the highly actionable everyday steps we can take to prevent it. Today, we're basically going on a medical detective arc. We'll start by understanding what CVD actually is, track down the root cause, look at how it attacks different parts of the body, and then, the best part, cover the exact lifestyle and diet strategies you can use to stop it in its tracks. And hey, don't sweat the medical jargon. We're going to break it all down step by step as we go. All right, let's kick things off with part 1, understanding cardiovascular disease and really defining the problem we're up against. So, before we can talk about the solutions, we have to know exactly what we're dealing with. What is cardiovascular disease, or CVD? Well, it's actually not just one single illness. It's an entire group of disorders messing with your heart and blood vessels. And it's no joke, it's a leading cause of death globally. The big takeaway here is that CVD is mostly about a dangerous, silent buildup of fatty deposits inside your arteries. And that buildup, it heavily increases your risk of some pretty scary, life-threatening blood clots. Which leads us perfectly into part 2, the root cause, atherosclerosis. Now, what's really interesting about this is I want you to think of your cardiovascular system like a massive, high-speed highway network that delivers vital oxygen all over your body. Atherosclerosis, that's what happens when this network gets hit with a massive, system-wide traffic jam. Take a look at the top of this cross-section. It all starts with these early plaques just kind of forming right inside the lining of the artery wall. Then, as you move down, you see that plaque growing. It's literally damaging the lining and squeezing that passage tight. Eventually, down at the bottom, boom, the plaque actually ruptures. A blood clot forms right over the rupture, and suddenly, that vital blood flow is either severely choked off or completely blocked. It's a total roadblock. So what happens when these roadblocks occur? That brings us to section 3, types of cardiovascular disease and how it impacts different areas of the body. Because here's the crazy thing. This exact same arterial traffic jam causes totally different but equally serious emergencies depending on where exactly it happens. The most common one you've probably heard of is coronary artery disease, or CAD. This is when the hardening and narrowing hits the specific arteries feeding your heart muscle. If your heart isn't getting enough oxygen-rich blood, you might feel angina. That's intense chest pain. But if a clot suddenly completely blocks that flow, that's a heart attack, causing permanent damage. Over time, all this damage can actually wear the heart out, leading to heart failure, where it just can't pump enough blood to keep up with what your body needs. But what if that blockage happens further up? If we shift our focus up to the brain, we're dealing with cerebrovascular disease. This shows exactly what happens when the brain's blood supply is cut off. On the left, there's an ischemic stroke. That's when a blood clot just totally blocks the pipe. On the right, a hemorrhagic stroke. That's when an artery in the brain actually bursts and leaks blood. Both are incredibly dangerous and cause severe brain damage. Oh, and you can also have something called a TIA, or a mini stroke. It's basically a temporary pause in blood flow, but man, it is a massive flashing warning sign. Okay, let's travel down to the limbs now. This is called peripheral artery disease, or PAD. When that same sticky plaque narrows the arteries supplying your extremities, usually your legs, it creates a huge bottleneck. See the poor blood flow labeled on the left and the completely blocked artery on the right? That lack of circulation actively starves the tissue. It causes chronic pain, numbness, and in really severe cases, you can get these dangerous ulcers on your legs, just from bad blood flow. We also really need to highlight aortic disease. Just check out the diagram on the right side here. The aorta is literally the absolute largest artery in your entire body. An aortic aneurysm is what happens when its walls get weak and sort of dangerously balloon outward. It's incredibly serious because it creates a huge risk of a fatal rupture. And just to give you the whole picture, the CVD umbrella also covers things like heart valve problems, congenital heart defects you're born with, and even rheumatic heart disease, which actually comes from a bacterial strep infection. All right, take a deep breath. That was a lot of heavy clinical stuff. Let's shift gears to part 4, lifestyle prevention strategies. It's time to talk about actively protecting your heart. This is where we go from the scary problem to the empowering solutions. These are the proactive, everyday choices you can make to protect your cardiovascular network. There are 6 crucial science-backed steps here. Number 1, a healthy diet. Number 2, regular physical activity. 3, stop smoking. Actually, let me pause right here for a second because the medical data screams about this. Stopping smoking is absolutely one of the most critical things you can ever do to prevent heart disease. Seriously. Number 4, actively managing your stress. Think deep breathing, yoga, or talking to a counselor. 5, getting regular checkups to keep your blood pressure, cholesterol, and diabetes in check. And 6, limiting alcohol to strict moderation. Now, out of all the numbers and stats out there, I really want you to burn this specific target number into your brain. 150. Why does this matter? Because 150 represents the golden target, the strictly recommended minimum weekly minutes of moderate intensity exercise your body needs. So whether you're briskly walking the dog, cycling, or swimming laps, racking up 150 minutes a week is literally your baseline armor for actively protecting and strengthening that heart muscle. Which brings us perfectly to our final section, Part 5, the heart-healthy diet, using food as medicine. We all know food is fuel, but when we're talking about cardiovascular health, your diet is honestly your ultimate weapon. It can manage existing conditions and stop heart disease from ever developing in the first place. Let's look at the big picture with these macronutrient guidelines. Get this, a whopping 55% or more of your daily calories should actually come from carbs. But wait, we're talking about healthy, complex carbohydrates here. They need to be your main energy source. Protein sits at about 15%. But look at the fat. That needs to be strictly controlled, kept to under 30% of your total calories. In fact, dietary fat is heavily cited as the single most important factor you have to control to prevent coronary heart disease. And since fat is the single biggest factor, we have to draw a stark contrast between the good and the bad guys here. Notice the physical difference on this list. Healthy fats, like the monounsaturated and polyunsaturated ones in olive oil, canola oil, or the omega-3s in a nice piece of salmon, they are generally liquid at room temperature. On the flip side, the dangerous saturated fats from animal products and those artificial trans fats and processed junk, they are solid at room temperature. So a great simple rule of thumb to remember, if it's solid on your kitchen counter, it's probably contributing to that nasty arterial plaque buildup we saw earlier. And this brilliantly illustrates how we turn that knowledge into real clinical practice. These are the American Heart Association guidelines. They compare a standard Step 1 prevention diet to a much stricter Step 2 diet, which is designed specifically for folks who need to aggressively manage high cholesterol. Just look at the difference. In Step 1, you're allowed about 300 milligrams of cholesterol a day and up to 10% saturated fat. But Step 2, they really tighten the reins. Cholesterol is capped at 200 milligrams max, and saturated fat gets slashed to under 7%. It just goes to show how incredibly precise you can get when you start treating your food as medicine. So what does this actually look like when you're pushing a cart through the grocery store? Well, here are your practical daily goals. You want to aim for at least 5 servings of fruits and veggies every single day. You've got to load up on whole grains, things like oats and brown rice, because their high soluble fiber literally traps and lowers your bad LDL cholesterol. Go for lean proteins like skinless chicken, beans, or fish. And this is crucial, you've got to drastically cut back on added sugars and keep your sodium under 2,300 milligrams a day. Dropping that salt intake is exactly what directly protects your blood pressure. All right, we've covered a huge amount of ground today. The mechanics of the disease, the terrifying reality of plaque buildup, and the exact lifestyle and dietary levers you can pull to fight back. It's a ton of information, but really, it all comes down to action. So as we wrap up this explainer, I want to leave you with a question to really chew on. What single heart-healthy change can you make today? Is it swapping out a solid stick of butter for liquid olive oil? Maybe it's going for a brisk walk to start chipping away at that 150-minute goal. Or honestly, maybe it's just throwing 1 extra serving of broccoli onto your dinner plate. The power to actively protect your long-term cardiovascular health is literally right there in your hands. Thank you so much for joining me on this deep dive, and as always, keep learning and stay curious.